The principle behind the treatment or the management of obesity in our center is that it's a comprehensive, goal-oriented, individualized management plan. And I just did not throw a bunch of big words together. I really thought about every word and how it is a reflection of our philosophy. It's comprehensive because we have our own dietitian, a psychologist, we have an obesity medical specialist, and we have the surgeon. And this team together evaluates the patient when they come in for the initial consultation and sit with the patient to arrive to the management plan that works for their goal. So for example, if somebody's goal is, I need to do something about obesity for the resolution of diabetes versus I need to lose whatever 60, 100 pounds, you have to look at that goal and come up with the plan accordingly. What I think your goal should be, it's not necessarily what you think your goal should be for you. And at the end of the day, it's your body, your life, and your decision, and I and my team will help support that and kind of guide you to the most effective management plan. So we have medical and or surgical arms, but the nutrition counseling, the exercise program, and the behavioral modification, these three are the common principles to whether you choose surgery or you do not choose surgery. The exercise program, something I'm very proud of. We have an excellent fitness trainer whose passion is to help work with people and help them exercise or learn how to exercise with limitations. The limitations could be mental, it could be physical. Some of my patients come on wheelchair, oxygen dependent. Some of them come in wearing sneakers. So there are all kinds of patients suffering from obesity, and it's important to come up with a program that meets that individual needs and work with whatever limitations they have. The reason why I brought the exercise program as part of the center is because I myself have gone to gyms for many years in many different parts of the country, and I see the same common scenario. You have to sign up for the gym, you have to sign up for the personal trainer. In addition, if you do go for the classes, most of the times the first 3 or 4 rows are these perfect figure females, and the people of size are hovering in the corner, kind of embarrassed and feeling awkward and not really getting the attention that they deserve. And that's why when I tell my patient, hey, you need to exercise, I know the average gym and the facility that's available to them, and that would not work for most of my patients with limitations. Hence the rationale of bringing a fitness trainer to the program to make it available as a resource so that they can at least get the training or the education of how to exercise right. And the idea is that they go back home and reproduce that without the need of big machines. The behavioral modification aspect, we have monthly support groups that are free regardless of whichever center or place you choose to go for your treatment. You're more than welcome to come attend these free monthly support groups. The timing and the schedule is available on our website, smmcweightloss.org. We also have started a monthly support group specifically for our post-op patients, as well as patients who've had bands put in either an outside institution or not. We have a special class just focusing on living with the gastric band, and we do that Monday mornings. So we have these resources to help patients adapt the new lifestyle. And again, the information is available on the website, or you can call 973-877-5498 for more information. The nutrition counseling aspect, I'll go more into detail with when I explain about the medically supervised weight loss program. So this program's goal is basically improving comorbidities and sustained weight loss. The elements about this program is, one is education. So the philosophy being similar to teaching someone how to fish rather than handing them the fish. And I tell my patients that even if you are contemplating surgery, you'll benefit from the education, because a lot of us don't actually really know what the difference is between carbohydrate, protein, the good carbohydrates, how to take your protein, how to do your grocery shopping, how to read food labels, how to handle like wedding, holidays, events like that, and they affect every one of us on a day-to-day level. The medically supervised weight loss program is a 6-month program. The first 3 months is weekly visits with the dietitian, and the next 3 months is monthly visit with the dietitian. The visits are in a group setting, like the group setting, because the idea is for patients to be each other's support system, to have that sense of accountability and responsibility, because the whole group gets weighed every week. When they come in, people don't know of each other's weights, but there is a timeline, and you can see people who are doing better than others, and that would help generate, I'm hoping, greater motivation to continue working on the weight loss goal. This program requires turning in food logs every week to the dietitian, where we make sure you're drinking enough water, exercising, as well as includes grocery store tours, just helping guiding how to do basic things that will affect your relationship with food. Closely monitoring vitamin and mineral levels. Contrary to popular belief, the obese patient is actually deficient in a lot of vitamin and minerals, and we pay a lot of attention and emphasis to this. So everybody who comes to the program, whether they sign up for the medically supervised weight loss program or for surgery or not, we recommend getting vitamin and mineral levels done, and then based on that result, we'll help guide what vitamins to take. Vitamins is another area that I feel that the commercial industry has not really done justice to the layman. When you walk to the grocery store, there are aisles of new vitamins. Every one of them market themselves as to be better than the other. But how do we know whether they're actually working or not? Most of the people have never gotten the vitamin levels checked. They buy the vitamins, they take the pills, and have no idea whether it's actually effective or not. That's the rationale of getting the vitamin levels done in the beginning and periodically checking them throughout the program, and also recommending the vitamins that we believe work based on the research and study that the vitamin companies have done. There's an integrated approach with nutrition counseling and exercise plans catered specifically for you, and behavioral modifications to work with your individual needs. I've already talked about these two aspects. So ultimate goal is sustained weight loss with resolution of comorbidities. Throughout this program, there will be visits with the medical doctor, timed the first 4 to 6 weeks, and then after that, based on the person's individual medical needs as well. Of note, I want to highlight, we are not replacing the primary care physician. We are basically guiding the patient through weight loss without putting them on any medication for that.